If you want to go to Harvard, you're not watching this video. You're in Harvard already, right?
No, we want you to watch this video because I'll beat you.
What's up, guys?
Welcome back to another video.
In heaven.
Yes, in heaven. We made it. All right, but today's a very short video on DO versus MD, similarities, differences, more specifically IMG MD, because there's a lot of students out there that don't really know where they want to get into, and they might not be as competitive for USMD school. So we're going to give you kind of both perspectives from our end, because I'm a DO graduate, he's a IMG medical school graduate. And we're going to give you both perspectives, similarities, differences, and where you kind of fit in.
Yeah. So what's DO?
So DO basically means doctor of osteopathy, right? Our main model of practice is thinking of the body as a unit. Instead of breaking up separate things into separate entities, like, oh, this GI tract pathology doesn't affect anything else, musculoskeletal complaint related wise or anything. We think everything is interrelated. Everything has a play. Even your mentality, even the way you feel has an impact on your health. So that's our basic approach, but now we're all transitioning into one single GME system where we're all thinking of an evidence-based medicine approach, right?
Yeah, just on that note, MD is like allopathic medicine, and it's based on clinical trials. For example, they take like a bunch of diabetic patients and they give one placebo and they give the other one metformin, and they see if they improved over time. And then it becomes standard practice. They showed evidence that metformin is beneficial, and then we start using metformin to treat diabetics. So it's very evidence-based practice on clinical trials and studies.
But more specifically, in terms of US IMG graduates, right? What did you find was the similarities or differences when you were in the Caribbean versus an MD that graduated from here? Because I'm sure you got the exposure to both worlds now.
Right. So I went to St. George's in the Caribbean, and it's modeled after U.S. medical school. So it's basically the same format, same everything. The only difference I felt was that you're on an island and you're self-learning more. You don't have as much support as you would here. But other than that, it's modeled after American schools. It's very similar. You know, you're studying the same things, same textbooks, same information. Everything else is the same.
Okay. Yeah. Any differences that you noted in terms of like the environment or where in terms of finances or semester breakdown?
The Caribbean schools, obviously, it's in the Caribbean, and in my opinion, they're much more expensive, especially like the top ones. You're paying a lot more because they market you really well, and you're doing your rotations here in America, and then you have a higher chance of getting a residency compared to the smaller Caribbean schools, right? You'll have a tougher time. And the support system in a way is similar, but you have less support in the Caribbeans. If you fail in the Caribbeans, they give you a little bit of break. They might let you try it once more, and then if you fail again, you're kicked out. But that's like very similar to American schools. But American schools, if you like kind of fail, they support you a lot in order for you to pass. And if you go to US medical school, you're obviously going to match at the end of the day, no matter how your grades are. But in Caribbean schools, you have to perform much, much better to be competitive for the same residency spots. So that's basically the kind of similarities and differences. You're on like an island next to a beach, which I liked. Like there were less amenities, but you know, I didn't mind that. I liked being there for like 2 years. I enjoyed myself.
Nice.
And after you come back, the next 2 years, you're doing clinical rotations, you know, in the States. You're back home, and it's very much the same as anyone else, USMDs or DOs. What about you? How was like the DO experience? What do you think was similar or different compared to my experience or USMD experience?
Yeah, so in terms of the DO experience, I found it to be a lot like the USMD experience, where in terms of the semester breakdown, it's the same. We're learning the same things every year to year. However, we have that additional component of osteopathic manipulative medicine that you have to be aware of. Osteopathic manipulative, definitely not. That's gonna give me Bell's palsy, bro. Just chill out. Parotid is right here. I don't want to mess with that. But like that additional component of osteopathic manipulative medicine, people don't understand that you learn everything the same as a DO. However, since you have this additional component of OMM, you have 3 additional hours of lab and 1 additional hour of lecture per week, and you're already on a time constraint in medical school. So if you take that into consideration, it's gets pretty demanding after a certain while, and you just kind of get things over with.
Right.
But the board exams is another component that you have to take into consideration, where we are only required to take the COMLEX level 1, level 2, level 3. We have no requirement to take the USMLE step 1, step 2, step 3.
Right.
So that's totally your choice. And every residency program now accepts the level exam as a totally functional exam that you can be accepted into that program based off of. In terms of finance, same as MD. It's much cheaper, actually, I'd say, because you're in America. For me personally, I thought it was much better. The school was right down like in the city from me, and it was like a 40-minute drive, so it wasn't a big deal.
Yeah, and I think the step 1 and the, what was it for DOs?
Level 1.
Level 1, they're very similar. This is the same material, and we can go in depth of like the differences of the test in another video if you guys want. Leave a comment below. At the end of the day, we end up in like a very similar spot. You're in internal medicine, I'm in internal medicine, and you can specialize in whatever you want. You're not limited as to which residency or which fellowship you can
You're
get.
definitely not limited, but one thing you guys do have to keep in mind is US DO schools are on average less competitive than US MD schools. However, I would say they're a little bit more competitive than IMG, US IMG medical Caribbean schools, you know?
Yeah, well, IMG schools, they kind of like accept everyone. It's not that hard to get into, but it's harder to make it out of it because they accept a lot of students. They accept everyone that's willing to pay, and then it's up to you. If you score good enough and you get a residency, they mostly leave it up to you to work that hard. So it's not hard to get into, but it's very hard to make it out of. So that's a consideration you guys should be making while choosing DO versus IMG. In that sense, DOs, you know, they are safer net than IMGs, because IMGs, if you don't match, then you're kind of like left all to yourself to figure things out. Whereas DOs, you have a higher chance of matching once you make it, but it's a little bit tougher to get into than Caribbean schools.
For sure.
But it's not that tough.
No. It's not as tough as US MD schools. I feel like both tracks are kind of getting more and more competitive, but it's still a really great option. Both options are really great options if you really want medicine as your life. One additional thing that I would like to add on is that, you know, with Caribbean schools, obviously I think there's 2 running cohort classes year to year, where it's like one semester is fall and January accepted for students. So there's 2 running cohort classes on year to year, but with the DO schools, it's just 1 year to year acceptance. So also keep that in mind. It also plays a
I think the benefit of that, like I was January class, and then if you're January class, you're ending your basic sciences like 2 or 3 months before the fall class ends. So you have like that extra time to kind of study for step 1, which was like way more important back when I graduated, because it was a numerical score. Now it's pass and fail, so it's not that big of a deal. You know, before you were just trying to get the highest score you can, because that's how you got residency, right?
Yeah, at the end of the day, you guys, you're gonna end up at the same place as you wanted to if you went to USMD versus USDO, unless you really want to get into one of those really academic facilities and want to go to the top places.
Well, if you want to go to Harvard, you're not watching this video. You're in Harvard already, right?
No, we want you to watch this video because I'll beat you.
All right, fine. He'll beat you. But if you're like on a note, like if you're going to Columbia or Harvard, you're not watching this video. You're watching this video if you're thinking of like going to DO versus Caribbean school. You're having trouble getting into USMD. So this is a video to kind of like tell you the differences between DO versus MD. Which one, based on your preferences, you should go down. Like, do you care about locality? Do you care about staying home? Do you care about like having KFC, having Starbucks?
Yeah, I feel like, you know, summary wise for this short video, I'd like to say that it essentially depends on your preference. What do you prefer? You know, there's obviously a change in location. There's obviously maybe a change in finance. There's going to be a change in how this semester is accepted year to year and board exams. At the end of the day, the end result is going to remain the same. You're going to practice medicine, but it just depends on your preference. If you have any specific questions that you were interested in that we might not have touched on, make sure to comment in the comment below, because we have a plethora of knowledge on this. So
like if you want to
definitely help you guys out
more in depth about the finances, or if you want to know about the location, or if you want to know more about how to apply for DO schools or different DO schools, or you know the process, or what OMM is, you know, the extra course in DO schools. And you know, anything else, leave a comment below and we can make a video on that further in detail.
For sure.
Yeah.
But make sure you guys hit that like and subscribe, because we got a bunch more content that's on the way, and we got another video coming out on student debt. I'm sure you guys don't want to miss that.
Right. Okay, see you in the next one.
Later.